Friday, and as we do every Friday, we like to check in on the fight against COVID-19 in Arizona's hospitals. So we go to Dr. Ross Goldberg, who's the president of the Arizona Medical Association and the District Medical Group Vice Chair of Surgery at Valleywise Health. And nice to see you again, Doctor. Appreciate it, always, as always. Thanks for being here. I don't think we have your mic. Do you have it on? Is that on our end or on your end, possibly? Give me a one. There we. Hello?
Can you hear me now?
Ah, we got you. Good stuff. Okay, here we go. All right, so sorry about that. So here we are. Yesterday we had the announcement that Maricopa County and Pima County both met the guidelines to open up schools again. Your thoughts on that?
Again, we've talked about this before. It's really that slow progression moving forward. Things have continued to work in a positive direction, and we're taking those baby steps to make sure that we're doing things smartly and safely.
How are things going? I know you're in touch with a lot of people, a lot of your colleagues at different hospitals. How are things looking hospital-wise here in the Valley?
We're moving in a positive direction also. I mean, our numbers are down, which are good. Not everything's not back to normal, and I don't know what normal is right now, actually. It's more of that slow kind of reintegration of what we were doing before and preparing what's coming next. You know, with the flu season coming up, it's just getting ready for kind of the next wave of patients and how to take care of them. What
do you mean by things aren't back to normal? How are things different now?
Well, it's a matter of we're still being very cautious, right? You know, the PPEs are still required. We're still being very cautious about visitation. We're slowly ramping things back up. It's not that we just opened everything back up again. Like everyone else, we're taking it one step at a time, and we're trying to still keep people safe. We still have people who are positive with COVID, so you can't just go back to kind of how things were before all this started. It's just a very cautious way of reopening things.
I've heard some reports that it appears, and I don't know if the virus is mutating or if you and your colleagues are just getting better at treating, but it looks like the virus is still very contagious, but not quite as lethal as it was. Is that what you're seeing?
Well, yeah, I think, remember, while we're still relatively new, if you look at the scope of understanding diseases, we're still relatively new in it. We've learned a lot since January. It's September now, so we learn and evolve as we go along and treat patients. So we learn every time we treat someone what works and what doesn't. So I do think we've become a little more aware of what does and what does not work and how to be aggressive early on. But there is still more to learn, and we're going to keep on doing that. So we know that these viruses mutate at times. They can be more infectious. It's a matter of just being vigilant and keeping on top of things.
There's a big debate going on about a vaccine and when it might be available. I know in the past, and we were saying at the very beginning of this pandemic, that it might take 1.5 to 2 years to get a viable vaccine. But now all of a sudden we're hearing talk of, depending on who you're listening to, November or possibly the end of this year. Are you surprised by that? Would you be confident in a vaccine that's ready in late October or even late December?
Well, here's the thing about all of this. We can put whatever deadlines we want. Science is going to take however long it takes. Our deadlines are deadlines we impose. Science will do what it needs to do. So if we do have a vaccine that is showing to be safe and effective, that's great. Now, I will tell you, if we're lucky enough if a vaccine is available before the end of the year, that does not mean that the vaccine's ready, and then once we do that, we go back to normal. We still have to keep on doing what we've been doing, the social distancing, the mask wearing, because that will still take time to have to kind of build up that immunity as well. So if the data's showing it, that's great. You know, I'm a data guy. I'm all about the data, the reproducibility, to make sure it's safe and effective. I'm not going to say, yes, we're definitely going to have one and we're not. The science itself will kind of guide that. And no matter what we say, that's what's going to ultimately dictate if it works or not.
Another way of looking at that might be is the science. If you have so many brilliant minds concentrated on one task with unlimited resources, which is kind of like where we are right now in terms of money, political will behind it. To me, it's almost like a Manhattan Project that built the nuclear bomb before the end of World War II. I mean, can you fast forward science?
Well, it's the way how you look at it. You know, another good example is the space program, right? And under a decade after announcing we would go to the moon, having started from scratch, we were on the moon. So it's a matter of, yes, you get all these brilliant minds together working, but you still have to run the tests and run the data and test it out. That's why we have multiple phases when we're trying out a new medication. You first got to make sure it's safe, and then is it effective? And then you need to have a large enough group take it and then watch them over time to see if it really does what you hypothesize it to do. So again, some of that you can't rush. Yes, large numbers are very good. These large groupings are a good sign. Prelim data is encouraging, but we're not going to long-term effects for some time because we can't speed up time. It's just a matter of seeing what happens over a period of weeks and months.
Right. And I'm not asking you to look into a crystal ball, but we're seeing some things happening here right now and over the course of the next few weeks that we haven't seen in a while. We're seeing large groups of people coming together on our college campuses, in dormitories, and on the campuses themselves. We're seeing some young elementary school children that will be heading back to school who haven't been there starting next week. If you had to project out a month from now, what do you think is going to be happening?
He rolls
You know, it's interesting. It's again, we're trialing it, but we're going to see what happens. My hope is that as we get these large groups together, that people should stay safe and social distancing, and we should be okay. I don't know. Though obviously, if we see problems, we're going to want to ratchet it back. We just got to really keep a close eye on things as we start moving forward.
All right, Dr. Ross Goldberg, again, thank you so much for joining us, as you do every week. Thank you for all that you and your colleagues are doing. You're a great source of information for us. We'll talk to you next week.
Yes, have a great day.
All right, have a great week. Thank you. Celeste.